Hello, my name is Kelly Migler and I am a DNP student at Regis College, and this is a lecture on culturally competent care. So before we begin, we need to have a little bit of background information on why culturally competent care is becoming so important in today's healthcare systems and settings. As you can notice, this is from the United States Census Bureau, and what I want to point out is that over the years and in the future, the diversity of the population in the United States is going to increase. And if we look over here at the under 18 age group, you can see that in the light blue is the white non-Hispanic population, and the dark blue, orange, yellow, and green are other cultural or ethnicity groups, such as Hispanic, Black American, Asian, Native American. And you can see how this is much more of an equal distribution between white, non-Hispanic, and other ethnicities compared to our older population. So as these individuals age, our population is going to become more diverse. And so we need to be able to provide patient care within the context of different cultures and populations. So when we think of culture, we need to recognize that culture incorporates many different aspects and characteristics of an individual. It relates to their physical, personal, social, family, and spiritual aspects of their life. It includes values, beliefs, attitudes, customs that they share and that are passed down from one generation to another generation, from the older individuals to the younger individuals within that population. Their culture also guides the way that they perceive things, how they behave, and how they evaluate the world around them. We need to look at the totality of their behavioral patterns, their beliefs, their values, their customs, their life ways, and how this affects their worldview and their decision making. So culture is largely unconscious, and it has a very powerful influence on health and illness. Culture is learned from birth at home. And we also have to recognize that different cultures respond differently to health, illness, and death. We also need to realize that culture expands beyond ethnicity. It includes religion, it includes socioeconomics, physical ability, mental capacity, sexual orientation, gender identity, and occupation. All components of a person's culture can impact their health. So some terms that we need to be aware of when we are thinking of culture and culturally competent care. Ethnocentrism. This is the view of a person that their own culture is superior to others. Cultural relativism is related to the attitude that other ways of doing things are different, but we recognize that they are equally valid, and that maybe there is not just one right way of doing things. And being culturally aware means that we appreciate those differences in diversity. We appreciate what makes each individual different. And cultural sensitivity relates to our personal attitudes and not saying things or behaving in a way that would be offensive to someone with different attitudes and different beliefs. And cultural blindness is something that we want to avoid. This is when a person, the word nurse is here because we're speaking in the healthcare setting, does not recognize his or her own beliefs and practices or the beliefs and practices of others. So culture is basically ignored and not acknowledged as being important. And nurses need to practice and be aware of all of these different terms in order to work on cultural competence. Sensitivity means that we have skills necessary to avoid disconnects with culture and spiritual beliefs or religious beliefs. Okay? It means that we're basically aware of differences and that we keep them in mind. And accountability means that we have made a decision to either use a person's cultural information or not use that information in our interactions with patients. Stereotype is another term that we need to be aware of. It means that we have a maybe preconceived idea of a person or a group, and it represents a very oversimplified opinion. Many times we think of it as a prejudice, an attitude or judgment about somebody just based on maybe their appearance or their culture or their religion. And we need to avoid making generalizations about individuals or thinking an idea, just a general idea, based on a stereotype. Okay? What we need to realize is that one culture is not better than another culture. Each culture is different. They have different characteristics, different values, different attitudes, different beliefs. That doesn't make one better or worse than the other. We are just different. So culturally competent care. Culturally competent care is care that respects the diversity of our patients. It relates to identifying that there are cultural factors that affect health and health care. These factors can be a language, communication styles, beliefs, attitudes, and behaviors. And we need to understand that culture is one strategy to improve the quality of care and eliminate disparities. There are health disparities that occur because of an individual's culture, diversity, or religion. And we also are learning that cultural competence is becoming an expectation of consumers. And when we talk about consumers, we're talking about patients. Patients that come into our healthcare settings from different backgrounds expect their culture, their diversity, their religion to be identified and incorporated into their care. Culturally competent care is a journey. There is not an end goal. It is something that we work on continuously. We have to begin with a process of self-reflection, which begins looking at our own beliefs, our own attitudes, our biases. And we need to know that all of that comes with us to every clinical encounter that we have with patients. We need to understand that all healthcare encounters with patients are cross-cultural in some way. Understanding that cultural competence is a patient-centered approach. We need to accept the different characteristics of each patient and bring that into each encounter. Patients bring with them their own understanding of illness and disease. And in order to create a patient-centered, safe and effective healthcare environment, we need to understand their beliefs, their attitudes. And understanding how you can partner with your patient to negotiate treatments means that they're more likely to follow the plan of care. The Office of Minority Health addresses that there is a need to become culturally competent in our society that is becoming more diverse each day. We need to have cultural and linguistic appropriate services that are respectful of and responsive to the health beliefs and practices of our patients. We need to incorporate a patient's culture into their healthcare in order to provide safe and effective outcomes. And by tailoring services to an individual's culture and language preference, we can help bring about positive health outcomes for diverse populations. It has been shown that when healthcare is not provided within the context of a patient's culture, that it can have negative outcomes in their health and lead to health disparities. So transcultural nursing, culturally competent care, often these terms are used interchangeably. Basically what it means is that there's a body of knowledge and practice for caring for persons from other cultures. This is not something that we can just start overnight without any knowledge or preparation. Okay? It takes a body of knowledge in order to begin the process to culturally competent care. So when we talk about culture, there are many different aspects that you need to think about besides just a person's ethnic background, their race, or religion. I think those are the three most common things that we think about when we think of culture. But we have to realize that culture is many different things that makes each of us different. So it can be related to the language that an individual speaks that's different. Their socioeconomic status is part of their culture that can have a great impact on a person's health that should not be overlooked. Their physical ability, do they have any limitations to their physical being that makes them more diverse, that can affect their health care? Mental capacity, any mental illness. Sexual orientation, are they a homosexual, heterosexual? Are they bisexual? Those are things that can have impacts on their health that should be is part of their being that needs to be acknowledged. And gender identity, how does a person identify themselves as a male, as a female? Okay? And occupation. Occupation is part of a person's culture that leads to diversity, that needs to be considered in their healthcare interactions. So when working with patients, you can enhance culturally competent care when you view them holistically. You recognize their cultural beliefs and behaviors that affect their perception of illness and treatment. To effectively deliver culturally competent care, you need to understand the psychosocial meaning and experience that your patients bring to their medical condition and help to integrate or coordinate your patient's traditional care approaches with conventional medical practices. So it's holistically. Do they practice different traditional remedies based on their culture? Can we incorporate that with traditional medical treatment? And as a culturally competent nurse, you must address both a patient's illness and his or her disease. Be aware of cultural and social factors that influence your patient's interpretation of illness and treatment approaches. Different cultures, different religions, individuals from diverse backgrounds will view illness, disease, and treatment differently. We don't all view things the same because of how we were raised, in what religion, what culture we were raised with, what attitudes and beliefs we were raised with will affect how we view health, illness, and treatment. And we need to consider those when we are creating a plan of care and interacting with our patients. So these are the most common things that we need to consider related to culture when we are interacting with basically all of our patients, because we are all different. We all come from different backgrounds, as I mentioned, with those different characteristics, those different things that need to be considered. So these are the common things we really need to think about. What is a person's values? What is their worldview? How do they view health and illness? What kind of treatments are they accepting to or would not even consider because of their culture? Communication. How do they communicate? What is their primary language? And we need to not only think about the verbal communication, we need to think about nonverbal communications. We need to consider things such as their personal space and boundaries. There are cultures where it's not acceptable to get very close, to not just automatically touch a patient, or eye contact is another thing that we need to be aware of. There are certain cultures that do not make direct eye contact. There are some that expect direct eye contact. If you don't look at them directly, then that's disrespectful. Time orientation. Time orientation means, do they live kind of maybe looking to the past? Do they live in the present moment? Or do they look to the future? Because that can affect treatment plans. It can affect how they get to appointments. If they are if they live in a past orientation, sometimes it makes it difficult for them to get to appointments. Do they value time? Western cultures value time. They're very time oriented. The Brazilian culture never makes appointments. Some Latin American cultures don't make appointments, or they don't come when you can. So there's different ways that individuals look at time, and that needs to be considered when you are setting up maybe follow-up appointments or treatment plans. How a person displays signs of pain. Pain management is different for different cultures. There are some cultures that are very stoic and will not express their pain. There are some cultures that freely express their pain. They're more vocal during periods of pain. There are some cultures that view pain management differently, and others will expect very, what's the word I'm looking for, appropriate or aggressive pain management. Family and gender issues. How do gender roles and family roles play as far as who is the head of the household? Who makes the primary decisions? Are men and women equal in the family? How are boys and girls viewed and treated? And then there are many different cultural practices and views related to pregnancy and birth. Who is going to be in the birthing room with the woman when she delivers? Some cultures do not want men, so the husband is not, or the significant other is not in the room. The woman's mother might be the primary support person in the labor room. There may be different practices related to the actual birth process or the postpartum period, related to foods that they eat. I know that there is the Hispanic culture sometimes views the colostrum, the initial milk after birth, as not being good. And so they will not breastfeed their baby until their actual breast milk comes in. There are different views as far as children, pediatric care. A big one is view on vaccinations, whether to keep the baby wrapped up warm when they first come home. The Catholic religion views that an infant should not be going out in public until they are baptized. Okay? And end of life has a lot of different practices and beliefs based on cultures, as far as who is there at the end of life, who makes those decisions related to end of life. And One is also the person who is maybe terminally ill. In some cultures, that information or that diagnosis should not be given directly to the patient. It is given to the family, who then decides whether the patient is told that. So there are a lot of different. And then just health beliefs and practices. There are many different components to this, just in everyday health and practices, as far as promotion, prevention, and when to seek care. And I know that this might seem kind of general, but there are just so many different beliefs and attitudes related to all of these listed here from culture to culture. So are you expected to know everything about all of these things listed here about every different culture? No, nobody can possibly know that. But you need to be aware that there are different beliefs and attitudes related to all of these. And so when you have a patient from a diverse background that comes in for care, and if you don't know, that's okay. But think about who is your best resource to ask those questions, the patient. So don't be afraid to have conversations with the patient and learn about these things during that patient encounter. And why do we want to know all of those things during each patient encounter when it's happening? Is we need to eliminate health disparities based on the lack of culturally competent care. And what happens is it affects the quality of patient care. If we don't acknowledge a patient's culture or diversity and incorporate it into their care is not going to be of quality. It's probably not going to happen in a timely manner. Your patient safety will be at risk, and it won't be patient-centered. If you don't include the patient's culture in their care, they're going to withdraw from the encounters. You need to include the patient and make it patient-centered. Otherwise, you are creating barriers to their care because they will not feel a part of it. It may lead to noncompliance. It may affect the way that the patients actually utilize the healthcare system. Different cultures may not seek treatment at the same time. They may wait. So we need to recognize and we need to include cultures so that they are aware of when they should seek help. Make sure that there aren't any barriers to them entering the healthcare system. And we also know that there are certain illnesses and diseases that are more prevalent in different cultures, different ethnicities. And so it is important that we acknowledge that we provide appropriate education, appropriate promotion, and preventative measures that address those specific illnesses and diseases in each culture. And we also need to recognize that there are individuals within cultures that may have other special needs, to children, the elderly, those living in rural areas. They may have barriers to care just based on where they live. And individuals with disability related, there we go back to their physical capabilities that can lead to disparities because they may not be able to access care. So patient-centered care is an essential component of cultural competence. A patient-centered approach involves being aware of the role of cultural health beliefs in a person's health-seeking behavior and being able to negotiate treatment options appropriately in a culturally sensitive way so that we can eliminate all of these things that lead to health disparities. Religions have different attitudes and beliefs that can affect health, illness, and treatment. Understanding is necessary to provide, once again, holistic care. So are there specific practices or rituals related to an individual's religion that might affect their health? So all of these need to be considered. We need to ask, maybe, what religion are there? That is asked in admission. It needs to be noted. And if it is different, we need to ask if there are any special considerations or practices or rituals that need to be considered depending on what health encounter condition they are seeking treatment for. Okay? There are different beliefs during the care of illness. The spiritual community support. Do they want to have their clergy notified so that they can come and visit, so that they can pray with them? There are different religious articles. Would they want to have those with them? Someone bring it from home. If they're Catholic, it might be a rosary. It might just be something of their religion. Are there special rites or there's blessing of the sick that they would want performed? And sometimes with different religions, there are dietary rules that they need to follow. And so we would need to know that so that we can accommodate that with their meals. And so baptism rites, circumcision is another one that needs to be considered. As I said, prayer. And so once again, speaking of dietary, food is a big component of many different cultures. There are certain foods that are eaten for different purposes, related to different body functions, related to different health conditions. In the postpartum period, there are different cultures that will eat different foods. They will eat hot foods or cold foods, or just avoid certain foods. Food is always used to help deal with emotional stress. So we need to know that. Food can be used as a reward or a punishment. Sometimes the type of food that we eat, have access to, is a sign of our economic status in the population. And there are cultures that use different foods to prevent or treat illness. And then, of course, food is a big social component. People gather around food, and it brings people together. So we need to also assess if they have food restrictions, if certain foods should be included, and why. And if we are able to accommodate that, then yes. So as far as providing sensitive care, how do we know these things? How are we supposed to know all these things? Because we can't know everything. So there's the 4 C's of culturally sensitive care: call, cause, cope, and concerns. You can remember this to help you remember what questions you should ask of your patients when you are doing that admission, or the first time that you are taking care of a patient, or during any patient encounter. The first one is call. Now, in parentheses, we think, well, what do you call your problem? But we don't want to say that to our patient. They may not understand what that exactly means. So we can just ask them, well, what do you think is wrong? Individuals view symptoms differently. The same symptom can have different meanings in different cultures. And if we don't acknowledge that, then we can create barriers to compliance. Understanding the patient's point of view can help healthcare providers during patient care deal with and break down those barriers to compliance. An example is there is a subculture in the Asian population where epilepsy is considered the spirit catches you and you fall down. So it's considered more of a spirit possession. It's not considered a medical condition related to the electrical impulses and signals in the brain. And so there is a difference there. So we need to understand how they are perceiving what is wrong before we just start telling them what we think is wrong, so that we can kind of bring the two thoughts together. Okay? Then cause. Ask your patient, what do you think caused your problem? Not everybody believes that diseases are caused by the same thing. Not everybody believes that diseases are caused by germs. There are some cultures that believe disease is caused by an upset in the balance within our body, the yin and the yang. There are some cultures that believe disease is caused because that person sinned and it's now a punishment by God. Or, as mentioned before, it might be a spiritual possession. So they also may need to include clergy to pray with the patient if they believe that it is a punishment from God. Okay? Cope. Now, what we're thinking in our head is, how do you cope with your condition? But we need to ask the patient in more basic terms. So we can ask them, well, what have you done to try to make it better? Who else have you been to for treatment before coming here? There are many cultures that will try herbal remedies or home treatments or even healers before entering the healthcare setting. We want to know that. We want to know what have they done already. Now, they may not want to tell you these things because they're afraid that you are going to ridicule them or make them feel bad for those alternative treatments. So we need to make sure that we are providing or doing our interview in a non-threatening, non-judgmental manner so that they will share this information with them. We want to know about the previous information because there are some home remedies or herbal remedies that may interfere or interact with medications that will be prescribed. Okay? The fourth C is concerns. And when we think, what we want to ask is, what are your concerns regarding the condition or the treatment? But we need to ask the patient in terms that they'll understand. How serious do you think this is? What potential complications are you afraid for? And how does this interfere with your life or your ability to function? So basically, we want to know the patient's perception of what is going on. Okay? We need to know what they think is happening or what could happen before we can start to develop a plan of care. And it's important that we know how they perceive their illness. So there's also the LEARN model for cross-cultural communication. It's not always what you say, it's sometimes how you say it. And so this can help with how you administer or how you engage in that interview process. So LEARN, listen. Like I said before, we want the patient to share their perceptions. We want them to share what they've done already for their health care or how they view their health and illness. So we want to listen. We want to listen in a sympathetic, non-judgmental, understanding way, okay? We want to get their expectations. We want to know what they understand. We want to approach it with an attitude of curiosity. We want to know how they're feeling, and we want to do it with humility so that we can develop a trusting and understanding relationship so that the patient feels that they can share with us and that they have become part of the healthcare team. Explain. We then need to explain our perception of the problem. And I'm not talking about you, the individual, not your own personal perception, but the healthcare perception, the medical perception, okay? Because we may need to be able to merge their perceptions, their expectations, their attitudes and beliefs with the medical component of it. And then we need to acknowledge. And by acknowledging, what we're doing is we're just being respectful when discussing the differences between their views and our views. And we need to acknowledge that, yes, there are differences, but if there are similarities, also point out the similarities. And then we need to try to determine whether their beliefs and attitudes may interfere with the therapeutic treatment plan. And how can we bring the two together? And that comes with the R, recommend. So we want to develop and propose a treatment plan that is acceptable to the patient and their family. Because if we try to force our attitudes, beliefs, and treatment plan on them, and it doesn't consider their cultural beliefs, they're not going to be compliant. So we're trying to create that patient-centered interaction where we can bring the two together, and so that they are treated with quality care that is safe and effective. And sometimes this may take a little negotiating in order to reach an agreement on the treatment plan, but we're doing this in partnership with the patient and the family. So, as the nurse, why we are doing this is because it will increase client satisfaction. The patients will be more satisfied with their health interventions, with their healthcare encounter. They will share. They will feel that they are part of their healthcare. Also, by providing culturally competent care and breaking down some of these barriers, because there are different attitudes and beliefs, and maybe they're afraid to access the healthcare system because they're afraid of being made fun of or their culture not being respected, we can promote access to the healthcare system. By incorporating a person's culture, we're providing more effective care. And so then we can reduce, hopefully, the length of their hospital stay, reduce complications, and then, of course, leads to a reduction in healthcare costs for the patient. So culturally competent care and providing healthcare within the context of a person's culture has so many benefits to the patient. And also you will find, I think, to you as the nurse, because you will create a relationship with that patient and you will get to know that patient, and they will trust you to take care of them. They will trust to share information with you. And so to have cultural awareness in your practice, you need to be knowledgeable of life ways, but as I said before, that doesn't mean that you need to know everything about every culture. You just need to be aware that there are differences in diversity. There are different attitudes, beliefs, practices, perceptions related to each of our cultures, each of our backgrounds, and that we're willing to acknowledge that. We're willing to learn about that. We don't want to practice in a culturally blind practice. We don't want to ignore diversity and what makes each of us different and needs to be incorporated into our care. We need to be aware of ethnocentrism and what are our beliefs and our attitudes. Okay? Cultural knowledge. We can't know everything. There are resources that we can find. Each hospital should have information about different cultures, interpreters for different cultures, so that you can speak to your client and ask these questions and learn about them. We need to keep in mind emic and etic systems. So emic system is when the local or the insiders, that's our view of values about a phenomenon. Okay, so that is the patient. What are their views about their health, illness, and treatment? Etic refers to the professional or the outside view of the phenomenon or the illness. So we're trying to combine the patient's beliefs, practices, and attitudes with that of the professional attitudes and beliefs related to treatment, and bringing them together to work together to complement each other so that the patient does not feel like their attitudes, beliefs are being ignored. And first, most of all, we must not stereotype, okay? We cannot just look at an individual and think that we know who they are, what they are like, based on some preconceived notion, okay? We need to get to know our patients. We need to ask those questions about their culture, their religion, their lifestyle, so that we can treat each patient and who they are, okay? So the next couple slides are things to consider. What kind of questions should we ask our patients based on those different cultural aspects that we talked about before, related to maybe time, religion, language, health beliefs, beliefs related to pediatric care, or their worldview, okay? So this is from the Office of Minority Health. This is a guide that they have that you can use to help decide, what questions do I need to answer? What do I need to know about my patient that needs to be incorporated into their health care? Okay, and so I'm not going to go through this whole thing, but maybe some of the things, an important one is always language. What language is spoken? What language does your patient understand? Okay, do you need an interpreter? If you need an interpreter, according to the Office of Minority Health, you should never use a family member as an interpreter. They may not understand what you are trying to ask the patient related to medical terms, medical information. You may not get accurate information back. So you should always use an appropriate trained interpreter, or every hospital should have some type of computerized interpreter within the phone system that you can call and use as an interpreter. And then also remember, it's not only verbal communication. Think about nonverbal, okay? Pay attention to their body language, to eye contact. Think about eye contact. Think about personal space. Think about touch. And then, of course, just what culture are they from? How do they identify? Okay? Are there any cultural restrictions that need to be considered? Modesty is a big thing to consider with different cultures. Okay? And then developmental. What beliefs or practices? This relates to end of life, pregnancy, death, taking care of children. Education. Education is important because this may have an impact on discharge teaching. At what level do they read? Are they able to read? Do they read and write in English? Do we need to provide discharge teaching printed in a different language? And then, of course, how do they perceive and describe their health? Do they use non-traditional methods of healthcare? And then the family. Family is a big thing. Do they want their family involved? Do they want their family with them? Do they want to be alone? Do they come from a big family where everybody is part of what is going on with the patient? Who makes the decisions? And nutrition. We talked about food. Food has many different meanings related to their culture or their religion, and it also plays a part in their health, prevention, and treatment in different cultures. And then their religion. Are there certain practices and beliefs that they would want to incorporate? And then their values is how do they view, what is their perception of health, illness, and treatment? We want this to be an effective, quality treatment of their illness or condition or disease. And so that's why we need to know what is their perception. Okay. So cultural competence means that you have an awareness that culture does have a big part of a person's health, illness, and treatment. That you're knowledgeable, not about everything about everybody's culture, but you're knowledgeable that it doesn't matter. That we need to be aware of what an individual brings with them into every healthcare encounter related to their culture or their religion or their lifestyle. That we have the ability, that we have the desire to work within that patient's culture, and that we respect their beliefs and practices. If a patient knows that you are interested in what their beliefs and practices are, that you want to incorporate them into their healthcare, you will develop a trusting relationship with that patient, okay? And they will be more receptive to the treatment plan. We need to be aware of our own biases, our own feelings, because sometimes that can influence others. If a patient feels that we think that our culture or our beliefs are superior or better than theirs, they are going to withdraw. They are going to feel disrespected. They are not going to want to engage in the healthcare relationship. Okay? Never assume anything, as I said before. Do not stereotype. Don't assume that you know something about a person's culture or religion. Ask. Okay? Don't make judgments. Be open to everyone's diversity. Be open to different cultures, different religions, different lifestyles. Be willing to incorporate that into their healthcare. And you have to be adaptable, because individuals from different cultures and backgrounds are going to bring with them many different components of themselves, many different characteristics, many different beliefs or practices. And so you have to think about, well, how can I incorporate that and bring that into the medical plan so that we can create a safe and effective encounter and provide for a good outcome for this patient. Okay? And so this is something that's going to go on throughout your career. As I said before, cultural competence is not something that you just learn and you know it and that's the end of it. It's something that you continuously learn. It's a lifelong learning process that you are going to incorporate in your nursing practice from now and forever. Okay? Thank you.